Hi, everyone. Welcome to RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator Dr. Stasha Gominak, answering some of our frequently asked questions, as well as others you may not have thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. So, Stasha, you talk about headaches and migraines a lot. What is the difference between a headache and a migraine?
Hi, my name is Stasha Gominak. I'm a retired neurologist and I'm a sleep coach now. And Heather and I are doing a series of short videos about single questions we've been asked. What's the difference between a migraine and a headache? First, let me say that anyone with a headache needs to have imaging of their head, CT or MRI, because there's no real way to distinguish between a headache that comes from something bad growing in your head versus having a migraine or a normal headache. The next thing to know is I was very interested by the fact that many of the people I was seeing for migraine said they also had their normal headaches. And in actual fact, migraine is a genetic disorder, but probably most of the people who have normal headaches just haven't had something that a neurologist would call a migraine yet. And you may never have one, but if you have the genetics to make normal headaches, you probably have the same genetics that could potentially make a migraine. That's very different than what most neurologists are saying. We've made up lots of names for other types of headaches: muscle tension headaches, stress headaches, sinus headaches. But in my view, headaches are on a continuum, with the mildest being just a normal headache and the most severe being a severe migraine and converting to daily headache. For a neurologist, the accompanying symptoms to make that distinction or make that diagnosis of migraine would be an accompanying visual aura or a visual experience before the headache, light sensitivity, meaning light seems too bright, sound seems too loud, nausea, frequently dizziness, a feeling that you can't think right, a feeling that your vision is slightly blurred. All of those symptoms tend to come over time. So there's also a timeline with migraine. Frequently, it starts as very mild. In some people, it starts with nausea or visual disturbance and then becomes head pain. In some people, it starts with head pain and then progresses. Over the last 30 years, my patients have constantly told me if I can get my medicine in soon enough, that means there's a enlarging number of symptoms over time. That's one of the things that makes me think a little baby headache can grow into a migraine under the proper circumstances. We're talking about this because, in my experience, the only thing that has permanently changed my migraine patients to normal headaches and then made them go away is improving the sleep. So my view of migraine is very different than other neurologists. I will have other videos on the YouTube channel to try to teach you about the way I look at migraine, but ultimately, I think there's no real distinction between migraine and headache in terms of what you need to do to make it better. Now, somebody who has a headache that goes away with Advil or just goes away on its own or goes away with another over-the-counter pain reliever really doesn't need to learn about migraine. But if you have headaches that are more severe than that or have any of these accompanying features that we talked about, then the RightSleep program is where you should go to learn about how sleep and getting your sleep better is directly linked to how severe and how often your headaches are.
Well, thank you everyone else for joining us. Please subscribe to the channel and then like and share our videos. You can find more information as well as the RightSleep workbook and program that Dr. Gominak just mentioned at drgominak.com. Remember, we see our doctor once a year because we heal our bodies every night. Until the next sleep chat.